For decades, schools have treated a student's mental health struggles as isolated incidents. An anxious or disruptive child is typically viewed as an individual problem to solve, strictly within the building's walls. The standard protocol involves a brief visit to a busy school counselor and a short conversation. At the end of the day, the child is sent back home, leaving the underlying issues essentially untouched. But severe anxiety and crisis do not stay confined to a classroom. Like a heavy drop of water hitting a stagnant pool, a student's struggle creates ripples that reach far beyond their desk. The first consequence hits the home. The entire family feels the strain of the crisis, yet parents are often left unsupported and unequipped to manage the situation once the school day ends. The school itself also experiences a breakdown. Without the institutional bandwidth to coordinate with the student's home, communication becomes fragmented and ineffective. Families trying to find external help run into months-long wait lists, high costs, and care providers who may lack a cultural connection to the family's background. This leaves schools attempting to address a deeply interconnected, family-wide crisis with tools that are restricted to the classroom. MentalSpace School was built to solve this structural flaw for Georgia districts, acting as a multi-tiered support ecosystem. The model starts by addressing the student at the center of the crisis. MentalSpace provides same-day teletherapy, matching each specific school with a dedicated clinical team to ensure the student has a reliable, continuous point of contact. These teams implement immediate suicide and violence prevention protocols designed to stabilize the school environment and protect the student. While stabilizing the individual is a critical first step, stopping the wider ripple effect requires moving beyond the child alone. To address the source of the strain, MentalSpace expands its care into a secondary ring that includes the student's family and home life. Recovery is more effective when the entire environment is treated, rather than just the child. Clinical teams deploy direct family counseling, parent education workshops, and structured communication plans that keep the home and school in sync. This also includes cultural competency training, which helps bridge the gap between a family's specific background and the institutional requirements of the school system. This diagram shows the financial model used to remove barriers for Georgia families. Costs for Medicaid patients drop to $0, and the system accepts major private insurers, including Blue Cross Blue Shield, Cigna, and Aetna. Licensed, diverse therapists deliver this care, ensuring the professionals working with families reflect the communities they serve. When financial barriers disappear and professional support reaches into the home, the student and their family can finally begin moving toward the same recovery goals together. When these individual improvements scale across an entire district, the impact becomes visible in the school's data. These charts track the results of families and schools finally working together. Attendance improves by 89%, student anxiety drops by 92%, and family satisfaction reaches 85%. These outcomes also help administrators manage a looming legislative reality, the July 2026 deadline for HB 2068 compliance in Georgia. MentalSpace provides a FERPA and HIPAA-compliant infrastructure that allows districts to meet this mandate through a single, integrated platform. Once a district partners with MentalSpace, the entire family gains access to a professional support network that previously didn't exist for them. Systemic change is possible when schools and families stop working in isolation. Visit mentalspaceschool.com